That skipped beat feeling, it could be a PVC. Let's talk a little bit more about what that means. What are the signs and symptoms of PVCs? So PVCs, which are also called premature ventricular contractions, are extra beats that come from the bottom of the heart or the ventricles. Now, everyone's symptoms are a little bit different. Some people say they feel a skipped beat. Some people feel they say a palpitation in their chest. Some people say they may feel a fluttering. And, I've even heard people say that they feel a flick or just that extra something happening inside of their chest. So those are some of the signs and symptoms of a PVC. A PVC, what is it? It means premature ventricular contraction. This is an extra beat that originates from the bottom chambers of the heart or the ventricles. And it often is benign in most cases. However, there are some cases where PVCs can also not be benign. So what causes a PVC? It's fascinating that all of the muscle in your heart actually has its own native electrical activity. And so these PVCs are just caused from areas of the heart that are letting off an electrical current and causing an extra beat. This often comes premature or before your native next heartbeat comes. And there's additional filling of the heart between the PVC and your next heartbeat. And that's why some people feel that extra heartbeat is actually stronger, that second one. How are PVCs diagnosed? They're diagnosed very simply with an electrocardiogram or an ECG. That's when we put 12 leads on you and we look at your electrical activity. Now, an EKG is really only about 10 seconds of your life. So if you're not having PVCs frequently enough, we might not catch it on an electrocardiogram. Interestingly, we also can put heart monitors on you. These heart monitors are wearable devices that may catch your PVCs, and they can be worn anywhere from 24 hours up to 30 days if necessary. And so those are some of the ways that you may need to have some additional testing and wear a monitor for longer so that we can capture those extra beats, just in case they're not happening all of the time. Some people can even capture these PVCs on their wearable devices, such as their iWatch. So there's a lot of different ways to look at that electrical activity and see if you're having an extra beat or two. What are the treatment options for PVCs? Well, good news is most of the time PVCs are benign. So if you're having a low number of PVCs or they're only happening here or there and not really causing any detrimental effect to your day-to-day life, a lot of times we just watch them. We don't do anything. Sometimes patients find that there's a specific trigger that they're having in their life that makes their PVCs more popular or more current, like caffeine or alcohol. And then people try to avoid those triggers, And so that's a really easy way to kind of manage PVCs more naturally. Another really nice way to help treat PVCs that I'm a fan of is magnesium. Magnesium supplementation is actually one of the older or more original forms of antiarrhythmic therapy. And so a lot of times I start with staying hydrated and taking some magnesium. Now, sometimes PVCs just are really causing havoc on your life and are really symptomatic and they just don't feel good. In those cases, we typically use medications such as beta blockers and calcium channel blockers to decrease the frequency of the PVCs that you're having. Now, in rare cases, PVC burden might be really high, meaning you're having more than 10, 15, 20% of your heartbeats are PVCs. In those instances, or when a PVC could potentially be dangerous, if medicines aren't enough and lifestyle changes aren't enough, then our electrophysiology colleagues will go in and they can actually find and ablate that exact PVC that you're having. And so there's a number of ways to treat PVCs, all the way from doing nothing and being reassured that it's not going to hurt you, all the way up to ablating it and actually having an invasive procedure to stop your PVCs. So depending on the amount of PVCs and how you're feeling is really how we determine what the best treatment options for you are. The best way to prevent your PVCs is identifying your triggers. Some common triggers include caffeine, alcohol, lack of sleep, stress, and recent infections. So what we like to do is, if you do know your triggers, really trying to minimize them and to make sure that you're avoiding some of those triggers of your PVCs. Now, some people just don't have triggers, and that's okay too. In those instances, we want you to make sure that you're staying hydrated, living a heart-healthy lifestyle, and staying active and eating healthy. And again, minimizing your alcohol intake and your caffeine intake to reasonable amounts. If you want to learn more about heart health, make sure to subscribe to the channel, and we'll see you next time.